Hello, my name is Heather Spaulding, and I'm a pediatric clinical nurse specialist student at California State University, Dominguez Hills. This presentation is for a research proposal to improve breastfeeding self-efficacy in Southern Nevada. This health promotion proposal will describe a research-based intervention of a health promotion disease prevention problem identified by Healthy People 2030. This topic is suitable to the role of the pediatric clinical nurse specialist and serves as a primary prevention intervention that will benefit the lives of the newborn and their mother. According to Healthy People 2030, over 4 million infants are born in the United States each year. One of the goals of Healthy People 2030 is to improve the health and safety of infants. Keeping infants healthy starts with making sure pregnant women get high-quality care during their pregnancy. After birth, strategies are focused on increasing breastfeeding rates, as well as vaccinations and developmental screening. Healthy People has two objectives to increase the percentage of infants who are exclusively breastfed. One is for 6 months and the other is for 1 year. This research proposal is focusing on the 6-month objective. The current baseline, derived from 2015 data, for infants breastfed through 6 months of age is 24.9%. The target for improvement by 2030 is to reach 42.4%. Looking at Nevada, a review of the CDC's breastfeeding report card was completed. Based on 2017 data, the exclusive breastfeeding rates through 6 months of age is 21.7%, ranking the state as the 43rd state for exclusive breastfeeding through 6 months of age. Improving the health and well-being of infants starts with primary prevention and understanding the baseline data. With the target goal of 42.4% for Healthy People 2030's objective of having infants exclusively breastfed for the first 6 months of life, is important to assess the data and the research. The data demonstrates low breastfeeding rates at the national, state, and local levels. At the national level, exclusively breastfed for the first 6 months is at 24.9%. The state rate is 21.7%, and the local rate, specifically at University Medical Center, is 18.8%. The literature that we will discuss here today will demonstrate how the assessing of a person's self-efficacy can assist healthcare providers in predicting breastfeeding outcomes within the first couple months postpartum and allow for additional support when identified. By offering a primary prevention intervention, such as an interactive breastfeeding course with web-based support, will positively impact the mother's ability to have a successful breastfeeding experience and improve the infant's opportunity for a healthy start in life. So how does the Advanced Practice Clinical Nurse Specialist, otherwise known as a CNS, play a role in improving breastfeeding self-efficacy? The CNS is the only advanced practice registered nurse who is trained specifically to work in 3 spheres of impact. In the patient sphere, the CNS can assist patients in changing and gaining control over their health behaviors. In the nurse sphere, the CNS can mentor nurses in professional development and can identify those nurses who may need a little encouragement in becoming certified lactation counselors, giving them extra training to support their patients with breastfeeding. In the organizational sphere, the CNS can lead and participate in quality improvement initiatives, which in this case is to help improve the exclusive breastfeeding rates at the local, state, and national level. With exclusive breastfeeding through 6 months of age being the focus of this research proposal, the target population will be the pregnant woman. Women who have low breastfeeding self-efficacy tend to see breastfeeding as difficult and may not follow through with their breastfeeding goals. Therefore, we will look to conduct research involving 10 to 13 pregnant women who are 20 years or older. There will be no exclusions regarding gestational age, ethnicity, or partner preference. The primary inclusion is the desire to exclusively breastfeed for the first 6 months. While there will not be a gestational age exclusion, participants will be encouraged to participate in the 3rd trimester, assuring the education will be closer to the time of delivery. The research and breastfeeding education intervention will be held at the Healthy Living Institute at University Medical Center. The breastfeeding preparation class will be held in the 3rd quarter of 2021, with the date to be determined. This research project will use both a theoretical and conceptual framework that will complement one another. The conceptual model used for this research proposal is the Pender's Health Promotion Model. Dr. Penders developed the model in 1982 to train professionals to focus on positive motivation when it comes to working with clients and help them move towards a healthy lifestyle. There are 3 key concepts in the Penders model: individual characteristics and experiences, behavior-specific cognitions and affect, and behavioral outcomes. The theoretical model of self-efficacy is an important aspect that intertwines with Pender's model. Self-efficacy was first coined in 1977 by Canadian-American psychologist Albert Bandura. He proposed that for an individual to engage in healthy behaviors, they must believe in their ability to have control over their own actions and life events. There are 4 contributors to self-efficacy: mastery experiences, vicarious experiences, social persuasion, and emotional state. In the late 1990s, Dr. Cindy Lee Dennis, a Canadian nurse, took Bandura's theory and adapted it to develop the breastfeeding self-efficacy scale. The tool was adapted in 2002 to lessen the number of questions. By having a new mother complete the breastfeeding self-efficacy scale, healthcare providers can identify if a mother is at high risk of discontinuing breastfeeding. With Dr. Dennis's scale, she was able to validate that a high self-efficacy score will lead to successful breastfeeding outcomes, which in turn leads to a reduction of many childhood illnesses. In the study done by Sari and Alte, the authors created this figure that depicts the individual characteristics and experiences that can influence a woman's breastfeeding experience. This includes such things as previous participation in or observation or hearing about infant care, the age of the woman, fear of breastfeeding or infant care, a person's cultural views on breastfeeding, education level, and economic status. Behavior-specific conditions associated with Pender's model are the perceived benefits of breastfeeding, perceived barriers, perceived parental self-efficacy, the act of breastfeeding, family or peers' perceptions of breastfeeding and the support they offer, and the individual's preferences related to breastfeeding. Behavior outcomes consist of immediate competing demands and preferences, such as the demand of every 1.5 to 3 hour breastfeeding demands, going back to work, how breastfeeding impacts their partner, planning for care of self and infant, and the time demands on breastfeeding. The ultimate goal of using Pender's model is for successful breastfeeding and infant care. Here I wanted to show you a couple images that represent self-efficacy theory and the breastfeeding self-efficacy scale. The image on your left depicts Bandura's self-efficacy theory. In order to develop a higher level of self-efficacy, a person must understand information they are receiving from one of 4 main sources of influence. One of the main sources of influence is performance outcomes or mastery experiences. Performance outcomes are associated with both positive and negative experiences and can influence a person's ability to perform a given task, such as breastfeeding. Now let's look at the breastfeeding self-efficacy scale and see how it fits with Bender's theory. When using the breastfeeding self-efficacy scale, all items are preceded with the phrase, "I can always," and graded with a 5-point Likert scale, where 1 indicates not at all confident and 5 indicates always confident. Let's look at a question and we'll pick number 3. I can always breastfeed my baby without using formula as a supplement. If this is a mother who has had positive exposure or experiences regarding breastfeeding, she is more likely to feel competent and perform that task well. The higher the woman's self-efficacy for this question, the higher likelihood that she will continue to breastfeed without using a supplement, such as formula. By combining the Pender's model and the breastfeeding self-efficacy in our proposed research, we can assist women of Southern Nevada improve their chances of being successful in their desire to exclusively breastfeed for 6 months or longer. In investigating the literature to support this research proposal, 3 studies were identified to form a best practice intervention recommendation to improve breastfeeding self-efficacy and improving exclusive breastfeeding rates. Study number 1 was a quasi-experimental study conducted in a single healthcare center in Iran. 64 women were divided into 2 groups. One group received a breastfeeding intervention as a single individual, and the other group received the education intervention with their mothers, or the infant's grandmother. The educational intervention was done in 2 parts. The first part was done between the 31st and 34th week of gestation. The second part was done between the 35th and 37th week of gestation. Both groups received the same education. To measure outcomes, the Persian version of the breastfeeding self-efficacy short form was completed at 3 time points: at hospital discharge, 4 weeks, and 8 weeks postpartum. The study demonstrated that breastfeeding education with the grandmothers in attendance was an efficient approach to enhance breastfeeding self-efficacy for the new mom. And the authors recommended for future consideration for family-centered educational programs. Study number 2 was a randomized control study completed in Turkey at 3 primary care clinics. The study included 71 women who were assigned either the intervention group or control group, and it was done by lottery method. The first meeting with women in both groups occurred during the 32 to 37 weeks of gestation. The intervention group was introduced to the education intervention, which consisted of a web-based education program. The participants were given a username and a password for the site and were asked to enter the site within 3 days. A daily reminder was made by text messaging to participants who did not enter the site. The web-based education was to be completed between weeks 37 and 38 of gestation. Women in the control group did not receive any education from the researchers, only the standard education that they received from their care provider. This study did not use the breastfeeding self-efficacy scale, instead used an 18-item parental self-efficacy scale. The authors also used an infant follow-up form, the Denver 2 developmental screening test, the Latch breastfeeding assessment instrument, and a health promotion plan process evaluation form. Participants' follow-up were completed at the first postnatal week and the 3rd month. For the sake of comparison of self-efficacy and exclusive breastfeeding, the intervention group had higher self-efficacy scores by the 3rd postpartum month, and the higher rate of exclusive breastfeeding at the 1st and the 3rd postpartum month. Study 3 was also a randomized control trial completed in a single center in Taiwan. 93 study participants were first-time mothers with a singleton pregnancy and included their support partners. There were 50 participants in the intervention group who attended a 3-week breastfeeding intervention program. The other 43 participants were in a control group and received standard care as administered by the participants' primary healthcare team. The educational interventions were held during the 3rd trimester, during gestational weeks 34, 35, and 36. The Taiwanese version of the Breastfeeding Self-Efficacy Scale short form was used for evaluation. Other data collection tools included the Taiwanese version of the Edinburgh Postnatal Depression Scale, Taiwanese version of the Stress Trait Anxiety Inventory, Taiwanese version of the Iowa Infant Feeding Attitude Scale, and a self-report questionnaire to determine rates of breastfeeding for moms. Outcome regarding self-efficacy and breastfeeding rates demonstrated that those that were involved in the intervention group had a higher rate of self-efficacy, which resulted in a higher rate of exclusive breastfeeding. The research-based intervention to be used to address this health promotion problem will be a structured, interactive breastfeeding education program. Recruitment methods will be done with the assistance from the Healthy Living Institute, or HLI. Amy Runge, Director of HLI, and Sochi Kambak, Registered Nurse and Breastfeeding Instructor, will assist in recruiting participants. A flyer will be emailed to obstetricians' offices and posted on the HLI website and Facebook page. Volunteer International Board Certified Lactation Consultant, or IBCLC, Colette Moore, will also be available when her schedule permits. Sochi and Amy will encourage those who sign up for the free public class to consider participation in the study. The participants will be enrolled in HLI breastfeeding class, which includes the use of the Enjoy Understanding Breastfeeding program. The Enjoy program was purchased by HLI and is offered as part of the free public breastfeeding class. The Enjoy program comes with a free companion web app that can be used on the participant's mobile device or computer. The web app offers videos and practical tools such as breastfeeding log, photos, instant parent polls, optional weekly emails, checklists, and more. The booklet is available and the web app accessories are available in both English and Spanish. Enjoy advertises that every Enjoy product is evidence-based and is updated regularly. For the participants who will be asked to commit to participating until their 6th postpartum month, participants will be given a free car seat for their commitment and their participation in the study. Once a proposal receives IRB approval, this flyer will be sent to the marketing department for branding, updates, and then distribution. Our objective for this proposal is to increase breastfeeding self-efficacy and support the mother in her goal to exclusively breastfeed for the first 6 months. We are also working to support the Healthy People 2030 health promotion objective. The 3 studies have all demonstrated that a structured breastfeeding program offered in-person and web-based has successfully improved breastfeeding self-efficacy and exclusive breastfeeding rates in countries outside of the United States. This study looks to bring the same researched evidence-based intervention to the women of Southern Nevada. The Breastfeeding Self-Efficacy short form will be completed after participants have been enrolled in the study in order to obtain baseline self-efficacy data. Participants will be encouraged to answer honestly, with 1 indicating that they are not at all confident that they can always agree with the 14 statements. A score of 5 would indicate that they are confident that they can always agree with the 14 statements. SurveyMonkey will be used to collect the data. The SurveyMonkey is the private account of the principal investigator and is password secured. The breastfeeding class at HLI will be an oral presentation with supplemental PowerPoint presentation. The presentation will discuss contents such as how breastfeeding works, getting the best start, latching on, breastfeeding positions, when to feed your baby, getting enough milk, breast care, and breastfeeding lifestyle. A complimentary booklet and web app access will be provided to all participants. Active participation will be encouraged during the 2-hour class. The primary investigator of the research study will be a master's prepared registered nurse who also happens to be a clinical nurse specialist student working at UMC. The breastfeeding class instructor will be a bachelor prepared board certified obstetric nurse employed by HLI. Based on researched evidence, the intended outcome for this research study will look to have all participants demonstrate increased breastfeeding self-efficacy scores over a 6-month period. A secondary outcome will include an increase in exclusive breastfeeding rates. The outcome percentages here were selected based on the average results of the 3 research studies. The evaluation plan will evaluate the participants' breastfeeding self-efficacy at 1 week, 1 month, 3 month, and 6 months postpartum. Additionally, the study will evaluate the frequency of exclusive breastfeeding versus formula feeding. Thank you for your time. Here are the references I used for this research proposal.